was my pointer, doctor? Said, where was my pointer? I didn't get one, he offered one.
Okay. Sorry for that.
You need to give one more point for that.
No, I'm
Yeah.
so sorry.
No, I
Okay, go.
So doctor is here.
Okay.
You maybe know.
Okay, go. Okay, sit. Do your job by yourself.
Thank you.
No, this is.
Good afternoon, ladies and gentlemen. Today, the topic I'm going to present is the heart valve disease. And as we all know that heart is the most amazing organ in our body. And actually heart is a pump. Why we call it the hardest organ in our body? Because it starts pumping blood when you are fetus at about 8 weeks to all the way until you die. So let's see inside of the heart. Yeah, looks like that inside. And average heartbeat is 100,000 times a day, and it supports the oxygen and the nutrition throughout the body, and also get rid of the waste product such as the carbon dioxide. And let's see this diagram. I did it this morning. Yeah, when the blood, it's a marker. When the blood come through these two big veins, and I just want you to know that every time I mention the vein, then you know the blood is going toward to the heart. So the vein to the heart, and the other side, the artery is away, the blood away from the heart. So an easy way to remember that they all start with the letter A. So now the blood goes through these two veins, and then the name is the superior. So as the doctor mentioned before, the superior means the upper one, right? The superior ventricular, and this one is the inferior. And the blood goes through these two veins, then go to the, so this is the right side, right? Go to the right atrium. So this is the right atrium. So when the right atrium contracts, then the blood goes through this valve. This valve is a tricuspid valve. Why we call it tricuspid? Because actually there's 3 flaps in this valve. So the easy way to remember is tri, so 3 flaps. So when the blood goes through this valve and go to the, this is the valve, this is the valve, and this is the right ventricle. And then when the right ventricle contracts, this valve close, and then the blood goes through this pulmonary valve. Pulmonary, we know that is means a lung, right? And then the blood, oh sorry, not this one. This one, this one, this one, and then the blood go to the 2 lungs, to the right lung and to the left lung, and then they get some oxygen and get rid of the carbon dioxide, and the blood go back to the heart, and go, so, do you know what is this mean? It's a vein or artery, you know that, because it's go, away from the heart, so what's this? It's a vein or artery? Yeah, it's an artery, yeah, so it's go away from the heart, means artery, then go to the lung, and then go back to the heart, so it's a vein. So, do you know why the color is blue here? Because not too much oxygen, right? But now, after that, go back to the heart, there's some oxygen, so the color is red right now. So then the blood go back to the, this one's left atrium. Then when the left atrium contract, then go through this valve is the mitral valve. And we also call the bicuspid valve. And then the blood go to the left ventricle. So, and then after that, the blood go through this valve is the aortic valve. And then go from the aorta. Go from this aorta and go, the blood go all the rest of our body. So it helps you for the EKG, right? Yeah, so now we know how the blood goes through the 4 chamber of the heart and how the 4 valves work now, right? Clear now then? Oh. So it is all the blood goes through this all here. And how do the heart valve works? And we know that every valve lies at the exit of each 4 heart chamber, and maintain the blood goes through one way toward and forward, one way forward, no any backward and no any linkage. And if the valve not work as the way they should, so there's some problem with the valve. So what type of valve disease? What are type of valve disease? Today we're going to talk about 2 types of valve disease. They are the valvulostenosis. Stenosis, that means that the valve is smaller than the normal one, and that means that it must make lots of blood, make more blood to it make the heart work very hard and make more blood to pump to the body. So there are four types of valve stenosis. They are the tricuspid stenosis, pulmonic stenosis, mitral stenosis, and aortic stenosis. And the second one is valvular insufficiency. Insufficiency, that means is the linkage of the valve, maybe with some infection, they lead that a hole or the linkage, the cause the valve cannot close tightly, so it suffer the valvular insufficiency. There are also 4 types of insufficiency. Also the tricuspid and the mitral, the pulmonary, and the aortic. So what caused the valvular heart disease? Some of the valve heart disease develop before birth, and some cause of valve disease is still unknown. But today we're going to talk about two types. The first one is the rheumatic fever. It is caused by the untreated bacterial infection. But luckily, some introduce of the antibiotic, so make the infection decrease the number of infection. The initial infection usually occur in children, but the heart problem associated with infection not be seen until 20 to 40 years later. So the second one is the endocarditis. That one is bacteria enter the bloodstream that cause the bacterial growth and the holes in the valves that links that lead to the linkage valve, and the bacteria enter the bloodstream through some ways such as the dental procedure, surgery, intravenous drug use, or other severe infection. Let's see the symptom of the valve disease. The first one is the shortness of breath. That means that when you are doing the daily activities, you will feel shortness of the breathing. And when you lie flat in the back, you need a pillow to pull it up and make you breathe easy. The next one is weakness or dizziness. That means that when you're doing daily activities, you will feel weakness and sometimes dizziness will occur. The discomfort in your chest, that means that there are pressure or the weight in your chest when you're doing the activities. And next one is palpitation. And the doctor mentioned before, what's palpitation? Who can answer me?
Heart beats fast in your chest.
Yeah, smart one, huh? Yeah, heart beat fast when at rest. That means that you may feel like a very hard random irregular heartbeats when you are at rest. Next one is swelling of your ankle, feet, or abdomen. This is called the edema, right? In your ankle, feet, or belly. Last one is rapid weight gain. That's horrible. For the female, right? Because weight gain of 2 or 3 pounds is possible by one day. Wow. Symptoms don't always related to the seriousness of your valve disease, and you may not have no symptom, but you have a serious valve disease. That's why we need to go to doctor and do some diagnosis and check the disease. The first one is the echocardiography, right? Yeah. That is use ultrasound to investigate the action of the heart. And the second one is TEE. TEE that involve a flexible tool with a transducer at the tip and go through your straw and go to your esophagus. Then can see your heart more detail, because that your esophagus just lie behind your heart, right, doctor? Yeah. So you can create a high quality of the picture of the heart and the blood vessel. And the next one is the catheterization. that insertion of the catheter into the chamber and the vessel of the heart, it can help determine whether you have a heart disease. Next one is the radionuclide scan. It is an imaging technique, the same as this one, the all image technique. Use a small dose of the radioactive chemical that can detect the infection of the heart. The last one, MRI, is also a medical imaging technique that used to get the picture of your organ in your body. Yeah, by looking at the result, repeat over time by your doctor, and he or she can see the progress of your valve, your heart valve, and then they can decide about your treatment. Oh, the medicine. Yes, the medicine. The first one is water pill. Who knows what is the water pill?
Diuretic?
Yeah, diuretic. That's smart one, huh? Yeah, diuretic. The one remove extra fluid from the tissue and bloodstream, and the second one it works as the name. It's the antiviremic medication. Is control the heart rhythm. It's a vasodilator. It encourages the blood flow in forward direction and not the backward through the leakage valve. Next one is ACE inhibitor, right? It's a type of vasodilator used to treat the high blood pressure and the heart failure. And this one, Jasmine, you need this one, huh?
What is it?
Little broker.
Oh.
Yeah. They treat the treat the high blood pressure and make the heart work slower and used to decrease the palpitation in some patients. And the last one is blood thinner. It prolong the clotting time of your blood. If the medication didn't help, sometimes you can do some surgery for the valve. And it looks fun, huh? The valve can replace, the valve can take from the piece of cows. Yeah, but the disadvantage one is the tissue valve may not last as long as the mechanical valve. Sometimes they refractory must be replaced after 50 years. And the second one is the mechanical heart valves, but also some disadvantage point. It is it lasts longer, but require lifetime use of blood thinner medication. So the last one is how to live with valve disease. Know the time of your valve disease and take good care of your teeth. Tell your doctor and your dentist about your heart valve disease. Call your doctor if you have any symptom of infection of your heart. Take antibiotic before undergo any procedure that may cause bleeding. Carry a Valium. You may obtain from the American Heart Association with specific antibiotic guidelines. Take your medication as a doctor prescribed. And see the heart doctor for the regular visit, even if you have no symptom about that. So that's all. Any question? We can discuss with doctor together.
I would like to thank you,